Hello, my name is Dr. Todd Hastings. In cooperation with my colleague, Dr. Margaret Kroposki, we had conducted a research study over the last 2 years for which we want to disseminate our results today in a podium presentation entitled Whole Health Meets Values, Attitudes Aligned with Mental Health Empathy on Campus. I'm associated with Cedar Crest College in Allentown, Pennsylvania. Dr. Kroposki is associated with the University of Phoenix. Thank you for your attention. And thank you for your patience. I may be moving my image about on the slides as we move forward. The learner outcomes are three. Describe three college educator concerns relative to effective learning about mental illness, attitudes, and perceptions of students. We're all, as nurse educators, champions relative to supporting cognitive and psychomotor learning, but sometimes the effective learning domain gets lost in our nursing curricula. So we want to enhance that and bring that out here relative to this consideration for addressing that domain specifically. Other outcomes determine two approaches for examining attitudes of college students relative to mental health and mental illness. We'll be conducting a mixed method study, as you'll see when we describe the study. And then identify two benefits of brief and practical interventions in support of improved college student feelings about people with mental illness. This is our overarching and most important purpose for conducting the study. Our disclaimer: we have no conflict of interest or commercial support related to this project. So the problem, and here we're talking about attitudes that we have, attitudes about people with mental illness. Now, the general population are influenced by images and labels, generating adverse impressions of people with mental illness. This is related to the seminal work of Becker. Mental health providers also hold stigma and prejudice against people with mental illness. So we have a broader societal concern, but also what about our providers? And then, for we as colleagues, we tend to be concerned about college students who demonstrate in the literature holding on to stigma and negative views of people with mental illness. And further, how college students in human service and health disciplines also hold stigma against people with mental illness. Then more specifically, nursing students having negative feelings about people with mental illness and about psychiatric nursing. And many of us who are nurse educators who have taught in the clinical realm have experienced this. Student anxiety about going to the clinical sites, and psychiatric nursing not being a popular choice relative to a specialty in moving forward for career paths. So these considerations of the study don't specifically address the latter issues, but certainly they're in our minds when we're involved in a project like this and when considering how we teach to topic and how we teach about mental illness and people with mental illness. So we do know, on the hopeful side, the third bullet, increased contact can be effective in supporting improved attitudes. But of course, that contact is subsumed within the clinical practicum, takes place within those clinical practicum timelines. What about having improved thoughts, feelings, attitudes, and perceptions before students get to the clinical realm to support an improved or more efficient clinical experience? That also is not specifically studied here, but certainly something in mind and some good idea for further research and direction relative to this type of project. So the purpose is challenge the meaning of the problematic labels that may impact attitudes relative to college students about people with mental illness, and that's important to consider moving forward. But also to apply educational interventions. Our hope is that brief and practical interventions will help improve college student impressions of mental illness, and also then just to facilitate development of better providers within our curricula and within our institutions, as well as a more inclusive and just community, and I would say campus community for sure, but certainly with implications moving forward for making better citizens who are more sensitive and aware about people with mental illness and that level of vulnerability. So this study is a mixed methods design. The target population, volunteer participants, were preclinical, actually. So you're thinking about from a 4-year program layout, freshman and sophomore level students prior to attending clinical practicums. We also looked at this beyond nursing, albeit the nursing students were probably roughly 90% of the volunteer participants. We were looking at psychology, social work, criminal justice, nutrition, and generic health science majors within our ranks. The total volunteer participant pool was 73. We actually had 58 students who completed all phases, pre-test and post-test, and I'll describe that in a moment, for the study. The survey tool we used was a valid and reliable instrument called the MICA-4, Mental Illness Clinicians Attitude Scale, by Gabadon Associates. This is based out of King's College in the UK, and the research teams of Graham Thornycroft are behind this. This survey tool included 16 items, Likert measures, and we were able to apply the tool to the SurveyMonkey platform for easy dissemination to our volunteer participants. For the quantitative portion, we used the MICA-4 tool at 2 phases, pre-test and at post-test. And in between, our interventions included educational media, 2, and I'll say brief, influential media clips. 1 from a documentary, Out of the Shadow, some of you may have seen, by Susan Smiley, and then a video created on campus of a mental health peer advocate from NAMI. Both of these interventions were roughly 30 minutes in length. What we did then was have students complete the MICA-4 at pre-test before they viewed the media, and then at post-test after they viewed the media, to allow for comparisons. So then we had a quantitative analysis done through SPSS version 24. For the numbers we had, we could look at parametric data comparisons, in this case the student t-test, with a total score and individual scores for questions. We also had a qualitative portion relative to this study that included focus groups on campus, 12 groups of 2 to 10 students, with 4 questions that were open-ended and added to the deeper meaning and the context for some of the responses we got through MICA-4 on the quantitative side. For the results, this slide refers to the quantitative results and indicating that overall there were results based on the analysis that suggested either statistical significance or the approach to significance for a change in expressed attitudes relative to the MICA-4 scale. Overall, we saw an approach to statistical significance for a difference at post-test. For select questions 1, 2, and 10, we saw clearly significant differences, considering again the cutoff is p equals 0.05. For these select questions, and 1 more that showed an approach to statistical significance. So if you have your MICA-4 survey in front of you, per the attachments for this presentation, you can refer to these, but I'll be more clear within the next couple slides relative to the meaning of this. So let's look at that research hypothesis and looking at the totals. Will college student attitudes about mental illness change after exposure to an educational media intervention? We would say that, based on the results, the difference approaches significance, and the p was 0.06, so close, not perfect, so a strong trend towards more positive attitudes relative to mental illness. Okay, so that was the important takeaway relative to the overall results. Then, with respect to specific questions, 1, 2, and 10, and the first 2 being reverse coded, showed improvement relative to the post-test results. So the first question, question 1, I just learned about mental health when I have to, would not bother reading material about it. That improved to more strongly disagree for this reverse coded item. Then for the second question, people with severe mental illness can never recover enough to have a good quality of life. That improves to a more strongly degree, also for this reverse coded item. Then for question 10, which is standard coding, students indicated in response to question, I feel as comfortable talking to a person with mental illness as I do talking to a person with a physical illness. This improved to more strongly agree at p equals 0.01. Then for one question that approached significance but not quite there, number 15, referred to colloquial terms that are disparaging and have been historically used to refer to mental illness themed and certainly toward people with mental illness. That also improved to more strongly disagree for this reverse coded item, again just approaching significance. So those are the quantitative results. On the qualitative side, from the focus group findings, we did look at several different themes that emerged when we performed thematic content analysis, but relative to the questions, comfort talking about mental illness, we saw codes that were significant. Most volunteer participants indicated they were comfortable before and after viewing the interventions, but they also expressed a unique coded consideration that mental health matters and deserves attention versus avoidance. This was not asked about, but this is offered on a regular basis and certainly, again, emerged as a code within the transcribed narratives. Relative to the second question, comfort with interaction relative to a person with mental illness. Again, most of the volunteer participants indicated they already had been comfortable in general, but they did indicate they were more comfortable with improved sensitivity. And also, they suggested another layer that emerged from the coding that was surprising, that for themselves, they still fear judgment of mental illness if they were diagnosed and if that label were applied to them. An interesting consideration and suggests how challenging this problem may be amongst our students and our budding student providers. For the third consideration amongst caregiver disciplines relative to treatment of mental illness, that codes emerged indicating again that the students could better appreciate mental health treating mental illness within institutional structures or settings. They also suggested that their awareness increased as an emerging code. And another surprising result that emerged from the queries within the focus group, that there's an increased need for advocacy as well as for treatment options. And this was not initially suggested, but certainly emerged as we looked at the focus group transcripts. Finally, we wanted to ask, was the perceived media effective? And we talk about perceived media, meaning the media items that we're looking at perceptions of mental illness. One being a documentary, one being a speaker who appeared in that clip as if live. So the whole notion about, do these brief and practical media interventions work? And the students suggested that these do increase their awareness. They do believe they lessen stigma, and hence the perceived here. They're perceiving the value of these media. And they also had another code that emerged within this, that they appreciate that recovery is possible, and that theme certainly resonates with them relative to the media interventions as per their impact and their feelings and their takeaways about those. So in all this, let's go to discussion. The influence of media as brief and practical interventions seems to demonstrate an effect or change to improve college student attitudes in human service majors, in allied health majors, in these helper disciplines, and improves these attitudes toward people with mental illness. So hence, these interventions may support an alternative to clinical practicums for contact and that substantive time commitment to effectively socialize students toward the goal of improved attitudes about mental health themes and about people with mental illness. So relative to the specific effect of the interventions in the media, we see relative to the quantitative results that responses indicate a greater motivation to learn about mental illness. When we refer back to, again, the first question, also a perceived comfort to engage people with mental illness seems to be significantly improved, and to discontinue use of stigmatizing language relative to both significant as well as approaching significance themes, certainly in comparing 2, 10, and 15 questions from the MICA 4. And then for the focus group qualitative results, the takeaways suggest greater insight and awareness was fostered in the student volunteers, and they can better appreciate the challenges to people with mental illness and the need for greater supports and advocacy, which was a very satisfying closure to what we found relative to the study. In summary, college students certainly require learning guidance in all learning domains, including the affective domain. Certainly, mental health stigma is problematic across our society, and especially now. Efforts in higher education to help students clarify and modify their values and perceptions about people with mental illness is critical. Faculty can use short-term student engagement approaches, setting the stage for long-term benefits. So now we're engaging through media versus the clinical practicums. What did we see as a benefit? We saw enhanced attitudes. And we believe empathy, although we did not measure empathy, and that certainly is a next phase or looking specifically at that concept. We're addressing vulnerability and vulnerable people, so we need to consider how we can foster better feeling and perceptions and caring for them. Also, that challenging stigma is operational, and that these types of media help in that process, with the hope that we're also preventing prejudice and discrimination among providers in training, since that was a concern in the literature. And finally, for us nurse educators, we tend to value, again, supporting a more just and sensitive culture, and especially during these challenging times, to support inclusivity and understanding is very important. Here are references, and I did provide a reference attachment. I want to thank you for your attention to this presentation, and I wish you a great conference experience. I look forward to interacting with individuals during the question and answer portion of the program. Thank you.